Kieran, what is it that Shimmer does?
So Shimmer is all about wearable wireless sensing. We take various different vital signs and signs about movement and transmit those wirelessly to wherever it is it needs to go. So the idea is that you would wear either an individual or a number of body-worn sensors that would pick up different information in terms of movement, things like ECG, things like fall detection, that type of area, and transmit those either over a mobile phone via Bluetooth, using the mobile phone as a gateway, or indeed in your home network, transmit those back to either your clinician, or in some instances the information might need to go to your neighbour or your caregiver or whoever it is that you would raise an alarm with. So we have both transmission capabilities and also local storage capabilities. So in some use cases, a GP, for example, might give the device to a patient and say, wear this for a week. We need to get a picture of how your daily living is, your activities of daily living is. And at that point, it wouldn't necessarily be streamed wirelessly. The information will be stored locally on the device. So when the patient comes back at the end of the week, they simply hand the device to the doctor, and the doctor can upload the information. So there's two methods of interacting with it, one more in real time and one more, I suppose, post the event.
So please tell us about your activities in Germany.
So we our business is broken up into two main sectors. We work a lot in the research and development market. So in those cases we supply development kits to researchers and academics and clinical hospitals around the world. We ship to over 50 countries, people carrying out a wide range of research activities. The other side of the business is on what we would consider the industrial or commercial scaling side of things. In Germany at present, we have a number of engagements with some of the leading German research institutes and universities, such as the Fraunhofer Institute and TUM in Munich, and a number of others around the region. Now, in some instances, we're more engaged in the research. In others, it's a bit more. We offer support in terms of the use of the hardware. So the idea, I suppose, from a research perspective, is that rather than having the folks in the universities develop new hardware continually, what we're saying is, use our devices. We will provide you with raw data. And you can then take that raw data and turn it into meaningful clinical information. So with Fraunhofer, for example, that's what their focus is. They're now taking this raw data rather than continually cooking up new hardware. They're focusing on really developing algorithms to understand what all this data can mean and when it's clinically significant. So they're looking at things like ECG. They're looking at things like ECG combined with motion, which is an interesting angle, because up to now you might have more traditional ECG, so streaming signals from the heart, electrical signals from the heart, but now we're able to provide motion information as well. So it can be very important if, for example, you fall and then you have a heart event, or you have a heart event and then you fall. Cardiologists really like to know in what sequence that happened, so it can be quite telling. So the work with most of our German partners is based on developing algorithms to really build a better clinical understanding of this data.
So how do you envisage home care to be taking place in the future?
Well, I think the demographic shift in terms of the aging population and the either shrinking or static resources that can be allocated to healthcare on a national or federal level is a challenge we all have to try and work together to solve. Now, our view is that there's a couple of elements to that. One is you would try and keep people away from hospital for as long as possible, and allow people to have better ownership and care for themselves. And I guess we can do that by areas such as independent living, by general monitoring, feedback to an individual perhaps when they are well, to keep them on that track. The other method is in terms of hospitals and allowing patients to leave hospitals earlier. So currently a lot of rehabilitation and the like would happen in a hospital setting, but what we're saying is once an operation has taken place, for example a knee replacement, rather than staying in and doing the immediate physiotherapy, that can be done at home using our devices. So it takes some cost pressures off the hospital, and it's also a better arrangement for the patient in terms of being able to not having to travel in and out to the hospital every day. I think in general terms, when you ask somebody about healthcare and you just do a quick response, the first thing that most people say around the world, it's pretty universal, is a doctor. And really, I suppose what we're trying to do is shift that the person takes some responsibility for their own health. So you can only do that really once you're empowered with these types of devices to actually keep track of things, and what you monitor you can measure and you can improve upon. So there's I suppose the approach of trying to keep people well and keep them better for longer, and then there's the approach of being able to free up more people, liberate them effectively from what we would consider the more mainframe hospital cares that exist today, which is push everyone into the hospital. So I think a more distributed system where it's community based is the future.